if you could wave your magic wand, what challenge do you have right now in your field that you would like technology to come and try to give you an answer to?
Well, Cherry's gonna go first.
Right now, I think my biggest challenge is finding mentors and role models for some of our programs to be with the girls. And one of the things Girl Scouts is currently working on is a virtual pathway. This is a way where the Girl Scouts will be able to connect with other Girl Scouts around the world. So if there is a Girl Scout that is homebound that cannot get out to participate in Girl Scout troops and those things, she can connect via the computer and meet with Girl Scouts around the world and still be able to participate in the Girl Scout program. I would like to see that taken a step further and use this virtual pathway to be able to connect girls with engineers across the globe so that they can see other career fields that they don't have in their backyard. Maybe connect with that scientist in the rainforest doing the plant studies, or the surgeon in Denmark working on that new surgical procedure, or even work with the engineers in Japan that are working to rebuild Japan after the devastation there.
I'm not sure if this directly answers the question, but it's one of the things that I see as the area of development in healthcare is we don't use social media in ways that I think could be very supportive of what we're trying to do from the standpoint of not only healthcare, but just health of communities. It's sometimes called public health, but it's just on this realm of how do we promote the idea that healthy communities are strong communities, and how do we use social media to support not only the delivery of healthcare, but the ideas around health that reduce the use of healthcare over time. Simple example, we have skyrocketing obesity rates in this country, and obesity is probably one of our largest public health issues. But how do you use social media tied into community activities that help promote the concepts behind healthy eating, activity, and then health care as it supports those that are sort of going down that realm towards diabetes? And the reason why I'm putting this out there is when you consider a disease like obesity and then or diabetes, which comes as a result of obesity, you're talking about changing behavior. It's all about changing behavior. I've been fascinated how social media changes behavior, both in good ways and sometimes not so good ways. So focusing on the good ways, how can we use those tools, technology if you will, and principles and concepts to apply to communities to get to a higher level of health overall? So I have a great question out there. I don't know what the answer is, but I know it's out there. I know, and we're not farming it. Do you know what I mean? We're not paying attention to that because in healthcare we're struggling with health reform, state budget cuts, how we're going to continue to do the day-to-day, much less get ourselves ahead of the day-to-day and look to the long term. But I really think that there's a lot of potential out there that I hope that as an industry we can start, and maybe it requires some entrepreneurs to be focused on that and help us adapt those social media tools to other areas.
And one last question before I'll open it up for some questions. What was the piece, we talked a little bit earlier, we saw some videos of the 1950s and 60s about these projections about, housewives get to push a button and dinner, the computer makes dinner and they get to go swim, play tennis. And then I also think back, and that still has yet to evolve, sadly. And then also thinking to some of the technologies, that came out with great fanfare and just crashed, like the Betamax, God. So I'm curious, just on a funny note, what has been kind of the Betamax of healthcare technology? I mean, what was something that came out with, or for socialization of girls? What was the thing that was supposed to make all the difference, it wound up being just something that had to go by the wayside.
Oh, I'm gonna have to think about that one. Healthcare specifically. I remember
early billing and practice management systems. This is, again, everything was paper. Everything, the whole healthcare system was driven by paper. So this would have been 15 years ago. I remember working for a company, and this was just when what we now refer to as practice management systems were being developed. So right now they're like amazing software that does amazing things, but back then it was very clunky, kind of database driven. You were basically trying to take procedures and automate them, but they really weren't looking at how the function should have been done. They were just applying technology to a process. These companies would just like turn off the phone one day, like you were talking to them one day, and the next day they'd be gone, and they'd be off the face of the earth, and you couldn't track them down. You couldn't find the owners, and all of a sudden you just invested this money in the software system, and you can't do anything. So those early years, yeah, those attempts. Now they did evolve, and now we have big, companies that, and maybe those were the entrepreneurial forerunners that it was a little ahead of their time. But yeah, that was pretty awful when you're trying to track down your software vendor. They just don't answer anymore.
I can't really think of anything with Girl Scouts in the STEM program, because the STEM program is still relatively new. We just recently celebrated 10 years. The main problem that I see that we run into on a day-to-day basis is that technology is so evolving. Every time you turn around, the latest computer is out, the latest cell phone is out, the latest whatever is out. And so trying to stay on the cutting edge of the technology and keep the girls up to date on what is out there and what is available is kind of hard. But on that note, I also take this as a learning experience for girls, because when you stop to think about it, if we did not have the design engineers and the product engineers constantly tweaking and working on some of the things that we have, say the cell phone, for instance, every teenager has a cell phone these days. If we did not have those design engineers and those product engineers constantly tweaking things, making things better, we'd all be still walking around with backpacks on our backs and bricks to our ears.